Delhi is facing immense health crisis as the air pollution in the capital is increasing at unprecedented rate. With me, I have Dr. Randeep Guleria, former AIIMS Director, who is here to talk about how one can save themselves and prevent further risk from the air pollution. Welcome to the show, sir.
Thank you very much. Thank you for having me.
Sir, the first thing, first things first, what do you have to say about the air pollution? Because we know that every day, we are getting new numbers of how many people are suffering, how bad the AQI is. So, what do you have to say about the AQI?
So I think what we need to really understand is that pollution itself is a silent killer, and it is a disease which we should not take lightly. We are having almost an epidemic of diseases which could be directly linked to pollution. It's important to understand what does pollution do. Pollution has certain substances which cause irritation to the airways, but there are certain substances known as PM 2.5, which means particulate matter, which is very fine, less than 2.5 micron, less than 1/100th of a hair. They are so fine that they go in with our breath into the lungs, deep into the lungs, and they can cross from the lungs into the bloodstream. So they damage the lungs, but once they reach our blood, they can travel from the blood to any part of the body. If they go to the heart, they cause narrowing of the heart vessels, which can lead to heart attacks. If they go to the brain, they can cause narrowing of the vessels in the brain, which can lead to stroke. There is now studies which suggest that chronic exposure to poor quality air can also predispose to what is known as dementia, and therefore, and in women, it can lead to infertility. So there are a number of diseases which are now being linked to air pollution, and that's why it is important for us to do our bit to decrease air pollution and also work in forcing or influencing policymakers to really deal this as a medical emergency.
In a way, you're saying that pollution affects the mental health, sleep, and productivity of a person.
Correct. It affects every aspect of life, whether it be sleep, whether it be mental health, and the effects are not only acute. So we talk about acute effects during the winter months, but the effects are also chronic. They also affect lung growth. So in children who are being exposed to regularly to poor quality air, their lung capacity gets affected. They are more prone to infections in later life. It also affects pregnant women. Pregnant women are not only affected themselves, but it affects the fetus. And there is data which suggests that it can lead to what is known as intrauterine growth retardation. The baby is born small. It can also lead to stillbirths and abortions. So therefore, it's important for us to understand that we need to protect not only ourselves, but the future generation by taking steps to decrease poor quality air.
Pollution, whenever one talks about pollution, they always talk about masks. So, are these masks really effective? And if yes, what kind of mask do people should really wear?
So masks do help to some extent, and if you are wearing a mask, you need a mask which filters out these toxic particulate matter. So an N95 mask is the best mask if one can wear that. Two important things. One is when you wear a mask, you should wear it tightly to cover your nose and mouth, because air should not go from the side but should go through the mask so that it filters out the air once you breathe in. And secondly, when you go out, when air quality is bad and you're going out in the open, if you wear a mask, it will give you some degree of protection.
Are there evidences to support the fact that pollution in a way impacts or in a way leads to various things like cancer, stroke, or reduced life expectancy to an extent?
Yes, so there are facts, all three are true. Smoking, poor quality air pollution is like smoking, and therefore it leads to, there's now data which we're seeing of higher incidence of what we call non-smoking lung cancer. Lung cancer was initially linked predominantly to smoking, but now we're seeing cancer occurring in non-smokers, and that is linked to pollution. There was data which linked bronchitis and cancer to indoor air pollution. Women cooking using chula with cow dung, wood, and kitchen not being properly ventilated, and a lot of pollution which is known as indoor air pollution. That is also being now seen as far as outdoor air pollution is concerned. So cancers are also linked to that. I've already mentioned strokes and dementia can happen because of the fine particulate matter going into the blood and causing effect on the vessels of the heart, of the brain. Therefore, yes, it can also decrease your lifespan. So there is data which suggests that it decreases an individual's lifespan because it predisposes to many diseases which affect your overall life.
Can long-term exposure to Delhi's air pollution in a way affect or permanently damage your lung or heart?
Yes, it can. So there are two things. One is older age group and one is children. So in the lungs, there is data which suggests that it will lead to damage of in the lungs, which leads to decrease in your lung function. Your lung capacity comes down. If you then move on to an area where pollution is not there, it will improve to some extent, but never come back to baseline. So the damage will stay to some extent. And there are studies from abroad which have looked at children who have grown up in areas where air quality was very bad, showing that their lung function was less. But interestingly, they showed that if you will improve the air quality, and these children continue to live in now in an environment where air quality was better, their lung function actually was able to catch up, and they were able to improve their lung function because that is an age when the lung is still growing and it can catch up. So it means that even if we try now, at least for children, we can improve the lung capacity if we are able to decrease the quality, decrease poor quality air. It will help the children in terms of improving the lung function.
When, in your opinion, should a person seek medical help if they feel that they are being directly affected, or the pollution is directly impacting them or their organs or anything that they are facing?
So, there are two parts in this. One is the acute effects, and the other is the chronic effect. Acute effects when you see during the winter months. So if anyone starts feeling breathing difficulty, chest tightness, pain in the chest, or palpitations, or is not able to breathe, or there's a heaviness in the chest, especially when there's been an exposure to poor quality air, that means there's an acute effect which is happening. Acute effect means that the air, poor quality air has gone into your lungs and is causing a significant damage to the or inflammation in the lung and the heart. On the other hand, as far as chronic effect is concerned, if you're living in an area where air quality is poor and you start feeling breathlessness, you start having features of fatigue, you feel that you're having some degree of memory loss or other features, then you must consult your doctor to see whether these could be related to pollution affecting various organs of the body.
You talked about women, especially pregnant women, that are affected by pollution. I want to know that women dealing with PCOS, endometriosis, or even anemia, are they more vulnerable to the pollution or to the harmful effects of pollution?
So PCOS, yes, it leads to mood swings. It can also lead to changes that can happen in women. Anemia itself is a problem in women, and sometimes because of that, their immunity becomes low. They're more vulnerable, and pollution also aggravates that vulnerability. So these are two areas where I think one has to look for the link that is there, and can the link actually cause more problems than either the disease alone.
The Do emergency measures like GRAP, do they actually prove to be effective? What would you like to say to that?
I don't think in the long run they're very effective because we need to have a sustainable solution. If you have something for a few days and then it comes back, so we have this sort of swings that happen. You have grab, you see if it becomes better, then you remove it, then again it goes bad. Those are not very helpful because actually it doesn't really come down to an acceptable level. It just comes down a little bit. So from very poor it becomes poor, but it never becomes good or acceptable air quality. So I think what we need to do is work on a sustainable solution where individuals and policymakers both work together and say that every year we will bring down the AQI by this percentage, and we try and work on that so that over the next few years we are able to say that there's a substantial decrease in the air quality in not only the NCR region but the Indo-Gangetic belt of our country.
You mentioned the use of N95 masks. Do they prove to be really useful for the expecting mothers or even little infants?
So for mothers, yes, because they can wear N95 mask. Little infants is difficult to wear an N95 mask, so it's better to keep them in an environment which is has good quality air and not letting them get exposed to poor quality air. But it's difficult for them to wear an N95 mask. But I would say yes, pregnant women, if they're living in an area where quality is bad, it may be helpful if they can. Sometimes pregnant women find it difficult to wear a mask, but if they can, yes, they should try and wear it.
What would you like to send a message to the expecting mothers or the girls who are planning pregnancy in such an extreme health condition right now?
So I would just say that you have to be a little cautious and careful, and if you are expecting pregnancy or you become pregnant, make sure that you're living in an environment which is having good quality air, uh, be indoor more than being outdoor. If you're going outdoor, wear a mask and be careful, because pregnancy is a vulnerable time, and air quality actually leads to worsening of that vulnerability in terms of causing effects on the newborn or the fetus.
Lastly, in your opinion as a doctor, what would you like to tell the people or the preventive tips that they can do at home to safeguard themselves or rather their loved ones, which can help them not just in preventing pollution because we cannot really help, that's not in our hands, but something that they can do themselves to just not escape but at least stay safe?
So two things. One is what you can do to really do your bit, and that is avoid increasing your carbon footprint. So if you can, you have to go to the market, walk if you can, rather than taking a car. If children are going separately to school, try and do carpooling so that less vehicular traffic is being used in terms of pollution. If there is someone in the colony who's using, the security guard is burning wood in the night to stay warm, see if you can give him an electric heater so that he can use that rather than have burning wood. So things that you can do to decrease the carbon footprint and make a small effort to decrease pollution in your area. What you can do to protect yourself, I think one is monitor AQI in your area, and if the AQI is bad, especially the vulnerable population, elderly, children, people with comorbidities, avoid going out. If you have to go out, wear an N95 mask. To some extent, you could use an air purifier at home. It may help. It's not something which is a definite solution. It has limited benefit, but it can be tried. Improve your diet. Take good amount of green leafy vegetables, fresh fruit, good amount of water, and at the same time, when you're indoor, do some breathing exercises. Yoga will help. These will help to improve your lung capacity, and of course, be careful about other habits like smoking, vaping, which you should not do.
Thank you so much, sir, for talking with us. And I hope your tips prove to be really useful for the people who are trying their level best to stay safe during these adverse conditions. Thank you so much.